I can see. Okay, so it's about the WHO. I put a couple of words up on the Google document, but I'll repeat them just before I get started. So there's PPE, ventilators, Wuhan, where the outbreak started. This word shouldn't be here anymore. Measles, cholera, polio, and tuberculosis. So just a few names of a few other diseases. That's about it. It's a piece that I kind of adapted from things that I read in the media, and a little bit of an opinion piece, not particularly my opinion. So that's about it. Shouldn't be any other issues. If everybody's ready and the sound's okay, then I get started. Okay. Good afternoon, everyone. I've got 5 minutes today to talk to you about the organization I fondly refer to as the WHO when I'm alone, but that I'll strive to call the WHO today. The World Health Organization was founded in 1948, so in the very early days of the United Nations. Its objective today is, and I quote, to ensure the attainment by all people of the highest possible level of health. So, with the COVID-19 crisis, has it failed in this task, or is the criticism of the institution unjustified? I don't think anyone here could expect the WHO to have single-handedly averted the crisis. They couldn't have known that a novel coronavirus was being spread in Wuhan, China, until they heard about it from the Chinese themselves, who were trying to keep it under wraps, it must be said. So if the WHO couldn't have stopped the initial spread, what else could they have done? When the WHO was informed by China about the existence of this coronavirus on the 31st of December, it launched its emergency response process the following day. Maybe on the 31st of December, they were a little bit busy. It has since been giving us all advice on the symptoms, on which drugs should or shouldn't be used to fight COVID-19, on preventative measures, etc. Since the beginning, the WHO has been outlining the need for a test and trace policy, the one used in South Korea to such great effect, and which we all now wish our countries had adopted from the beginning. My country, the UK, for example, was leading towards a herd immunity strategy for several months before they realized just how many lives this would cost. The problem for the WHO with pandemics is that they will always be criticized either way, either for being too cautious or too extreme in their advice. This time, with COVID-19, countries scoffed when the WHO suggested stopping international travel, large gatherings, and so on. Now they regret this, of course. And yet, I believe we can all understand this reaction from countries, as citizens were not fully aware of the risk, and to completely shut down a country from one day to the next would have led to uproar. In Italy, like in many countries, the Parliament has since launched an inquiry into the government's response to the crisis. And I found that the Italian Prime Minister Giuseppe Conte's explanation summed up the dilemma that European democracies were facing in the early days of the crisis. Mr. Conte said, "If I'd have put the country into lockdown 2 weeks earlier, you'd all have said I was mad." This pretty much sums it up, in my opinion. Another thing the WHO has been blamed for is for not encouraging countries to have more personal protective equipment, PPE, masks, hospital beds, etc. But this is something that countries decide entirely on their own. I know that my country of residence, France, had plenty of masks around 15 years ago following a flu outbreak, but it has since let its stocks run down because masks in a warehouse somewhere are just dead money. So why is it that Donald Trump, in particular, has been attacking the WHO so much of late? It seems to be part of his strategy to realign the United States with other countries than its traditional allies. The US removed its funding from UNESCO several years ago, and Donald Trump has been threatening to remove US funding from NATO since his campaign back in 2016. He has now announced he will reduce funding of the WHO to 10% of its former pre-COVID amount. Of course, this could just be empty threats by Mr. Trump in an attempt to get things in return from the WHO and the UN in general. Defunding the WHO is especially dangerous for low-income countries in which the agency's work is crucial to maintaining public health and to tackling killer diseases. The WHO's epidemiologists, doctors, and logistics personnel are currently working on over 35 emergency operations, including a measles outbreak in the Democratic Republic of the Congo and a cholera outbreak in Yemen. On top of its emergency operations, the WHO handles ongoing efforts to treat tuberculosis, diabetes, and to eradicate polio, as well as to study tropical diseases. This is all done on an annual budget of roughly $2.4 billion, whilst the US Center for Disease Control and Prevention has a total budget of around $12.7 billion. Maybe Donald Trump would be better off trying to save money elsewhere than with the US's contribution to the WHO. To conclude now then, in my opinion, the WHO didn't cover itself in glory during this crisis, but in normal times, states don't listen to its advice, and then in times of panic, everybody was looking to them for a miracle solution. Basically, the WHO was an easy scapegoat for countries all across the globe who didn't want to take responsibility for their lack of foresight, their lack of PPE, lack of hospital beds, ventilators, etc. That's all for me. Thank you.